Welcome to The New Health. I'm your host, Jessica Preston. Here at The New Health, we speak with thought leaders in health and wellness that are changing the world in the healthcare world and how we can make things more thriving as opposed to surviving. And today we have with us again James Maskell. Thank you so much for joining us again.
Great to be here, Jessica. I'm excited.
I'm excited too, and I know our topic today is really exciting. So we want to talk a bit about community groups in health itself. And so I know we've talked about community and how that can be helpful outside of the healthcare system for health ourselves. How about in the healthcare system?
Yeah. Well, what I wanted to do today, we've talked a lot about how individuals can take advantage of community to keep themselves healthy. But I want to give people some examples of what this could look like at scale. Like, what does this look like in a world where we're looking to build the new health, right? Yeah. Can this work at a reasonable scale? Can this solve the problems of today? I'm going to give you two examples that actually come from England, where I grew up. And England is interesting because they have a socialized healthcare system. One of the reasons why I moved to America was because there's way more innovation in America. Because of the crazy system that we have here, there's a lot more pockets of innovation. There's not as much, there wasn't as much when I left in 2005. But I'm going to give you a couple of examples of things that have happened in England that I think could be dramatic if applied here. So the first topic I want to talk about is about type 2 diabetes, right? Most prevalent chronic disease. Most people in America either have type 2 diabetes or on the journey to it with pre-diabetes. And ultimately, this is a massive issue, because if you have diabetes, you often have other things too. You might have anxiety, you might have fatty liver disease, you might have an autoimmune disease. So it's really like the tip of the spear. And if we could solve this, a lot of other things would take care of themselves. So there was a doctor in the UK. He was a general practitioner called Dr. David Unwin, and he discovered, as many people have discovered, and maybe you probably know someone who has reversed their type 2 diabetes with lifestyle, right? And again, part of the reason why there's a lot of marketing that you think is culture happening, but ultimately, type 2 diabetes is generally like a lifestyle-driven disease, and it's mainly driven from overconsumption of sugar, right? And so Dr. David Unwin realized this and went on a journey himself to see whether he could improve his health markers through lifestyle, and he found that he could, and he saw so many examples, and he worked with a couple of patients in his office to say, well, why don't you change your diet like this, and you can reverse your, and he saw type 2 diabetes being reversed in that sort of support. But he also realized that he couldn't do that for his whole population, right? He was a general practitioner, had that. So his wife was a psychologist. So once a week, they just started doing a type 2 diabetes reversal group, right? So where they would come into a group every week, and people could come, and when he was in his doctor appointments, he'd just say, hey, you could join this group. Now, that started in 2015, 2016. He was named 2016 Doctor of the Year, Innovator of the Year in the NHS for this group. And over the next few years, collected data in his business, in the practice, to see the uptake of that, how many people had actually chosen to be in the group, and what the results were. And it's incredible. I can't stop talking about it, because it's once you understand how powerful this is, you realize medicine should just be like this. So you can see the outcomes in the British Medical Journal, but essentially half the people who went into the group reversed their type 2 diabetes. And that's hundreds of people across a practice. And that was people getting together to be in group once a week to talk about what they were eating. And his wife, the psychologist, was providing support there. And not only did that have a tremendous effect on those people's health, but he was able to send back so many diabetes drugs to NHS Central because they didn't need those drugs anymore, and the savings of those drugs represented, if you multiplied that across just the whole of that country, it was £250 million, even just on the drug savings. Never mind on the savings of all the other drugs that people are on, all the other care that they don't need, because people who don't have type 2 diabetes don't need as much care. They don't need to come to the doctor. They don't need to be monitored. They don't need to keep taking insulin. They don't need to keep taking metformin. So, that is just such an easy example. And all this guy did was literally say, once a week, there is a safe place that I am creating that anyone in my practice who has type 2 diabetes can come to. And that is a dramatic success. And you can see, there's this amazing graph that shows the cost of diabetes drugs across all the practices in the area. And it's and then like this, because he was doing that. And I give that example because a lot of people think like, okay, well I could, people maybe at this point someone who has reversed their type 2 diabetes with lifestyle or chronic disease with lifestyle, but you often think, well, how could this apply to, in this case, a village? And there's a perfect example.
That's incredible. So this was recent. You said this was 2015, 2016? Is that
He was
is that when this
2016 Innovator of the Year, but he tracked his outcomes 16, 17, 18, 19, then it was published, I think, in 2021, and showing the number of people that had chosen to go on this track, which was not all of them. It was about half the people in the practice did, and then half the people who went into those groups reversed their type 2 diabetes.
Okay, and then how big of a
hundreds of people.
Hundreds of people.
I mean, you think a medical practice might serve 5,000 people. Not everyone has type 2 diabetes, but you're looking at hundreds and hundreds of reversals over that period of time.
That's amazing.
Yeah,
that's
simple
amazing.
too. It's like not a big deal.
And it was simply his wife started this group, or said
him and his
he should
wife.
start this
Yeah,
group.
so it was like education. At the beginning, it's education, looking at studies, looking at ways to cook, looking at ways to remove sugar from the diet. So that was like phase one. But then over time, it's like self-supporting, because now it's like, well, look at Jenny, like look what she's done, and now everyone's like, oh, I want to be like Jenny. So it's once it gets its own momentum, where it's no longer the gurus telling you what to do. It's like, look at all these people who have reversed their type 2 diabetes. Do you want to be like them? It's easy. Just show up at this group every week.
Yeah, that's great. So, and then also, and Jenny has a certain recipe that she brought because she really liked it, and it was really good for her. And so everyone shares the recipes, ends up being a recipe group. So potluck, that probably makes good sense too.
Yeah, exactly. So that's one example, one disease, right? So I wanted to use that. But is there a way that we could reduce all diseases by a similar type of idea? Now, there's a town in England. It's called Froome, and if you're watching at home, it's Frome if you want to Google it. But if you just Google Froome Health, there's plenty of articles that have been written on what I'm about to describe. And this is a doctor who decides that there's too much loneliness in the community and recognizes the level of loneliness going out there, and goes around to think about how to solve that. So they get a grant from the NHS. There's 5 medical practices in a town or an area of basically serving like 100,000 people. So now we're looking at like a reasonable sized town and sort of outlying villages in the Froome area. And they decide what they're going to do is they're going to hire 5 like health coaches, link workers, who are going to essentially identify all of the different groups that exist in community, right? 400 different groups. They made a list of every group that met. Church group, sports related group, men related group, women related group, anything that was like a group of people meeting together, it was put into a database. They went through that to say, is it consistent? Does it always happen? Is it healthy? Whatever, like they had these, and very few of them were health related, but they had a list of 400. Then they hire these 5 health coaches, and they put them, half their time they're sitting in the practice and half the time they're sitting in cafes in the town. So they actually go half of their time to these talking cafes. And basically the doctors can prescribe people to go to these cafes or to see the coach, and the coach's only role is to connect people to at least a few of these groups to go and check out. Then they start recruiting people in the town to actually become sort of leaders of this movement to reconnect. So they wear these green lanyards, right? So the taxi driver, the Uber driver, the landlord of the pub, someone who works in the pub, the hairdresser, these people are voluntarily stepping up to say, I'm going to be a community connector. And they identify themselves with these green lanyards, right? This happens. Now there's up to 2,000 right now. So there's 2,000 out of 100,000, 2% of the population have signed up for this. This town solved loneliness. I don't know how else to say it, but like everyone who needs to be connected is connected. No one is lonely. These groups are full. It wasn't that difficult to work all this kind of stuff out, and it is a model for the rest of the world on how to solve that. And the cost of healthcare, when everyone else in the local area, the cost is going up like this, all the time going out, the cost here is going down. And there's a dramatic change over a 5-year period by solving loneliness. So I share that because that is an example of a whole town doing it and getting behind it and solving it. And I think that that's the kind of energy, like so many people I meet, and where I live now, I live in a small town, people are proud of their town, people are proud of like the community that they live in. How are you going to show it? How are you going to actualize the strength that we have in this town. And this is a challenge that I would offer for you if you're sitting at home, is like, read up about Froome. There's videos about it. Think about it. This is available to anyone, anywhere, to think about, to lead this into their community. All you need is some critical people who are sort of leaders in the community to get behind this idea, but it's not that difficult. It was really just about creating a structure where you could see what groups already exist and then connecting people to those groups. And ultimately it just takes a little bit of like emotional energy, it takes a little bit of energy to like facilitate that, but now the system takes care of itself. And I just feel like when I tell people that story, I think most people just feel like, yeah, we could probably do that.
Yeah, I have to say, I don't think I've had a smile this big on my face in a really long time. This is a wonderful story. I have to read about this town, definitely.
Yeah.
How could people, what's the first step that someone, if they wanted to do this in their community, how can they step forward?
Well, I think you could read about it, find out about it. There's a website where you can see the community connections. It's actually Mendip is the area, and there's a website about it there to find out. And yeah, like I'm actively trying to facilitate this kind of thing to happen in America. Actually coming up, I'll be speaking at the Independent National Convention about ideas like this. And there are a lot of people that are interested in doing these kind of things. Young people want to get involved in things in the community. And I think that this is probably the number one model that I've seen where, where local action could be transformative to a community and their health.
This is incredible. I'm so glad you shared that with us today. So James, can you please tell our audience what you're working on and how people can reach you?
Yeah, my website is jamesmaskell.com, and you can see all the different projects and things that I'm working on there. And then you can also find me on Instagram at Mr. James Maskell.
Thank you so much for coming here once again. James will be back with us next week. And please stay tuned after these messages for our next guest.